Hi, my name is Mamita Mahajan and my student ID is 184249777 and I'm going to start my PCA video now. So I've got Miriam Adib here, fractured ribs. So the doctor has charted morphine. Okay. Hi Miriam, this is Mamita, one of the student nurse who is looking after you today. How are you?
I'm good, not bad.
Okay. The doctor has charted some pain relief for you. So before I do anything, can I just check your ID? Can you state your full name and date of birth for me?
My name is Miriam Adid. Date of birth is 7th of January 1969. And our number is 1749631749963.
Miriam Adib, date of birth is 1969, MRN is 174963. Thank you, Miriam. Do you have any allergies at all?
No,
No allergies? That's good. So are you in any pain right now?
I am in a pain
So whereabouts is the pain?
on my chest.
On your chest? So from 0 to 10, how bad is your pain? 0 being the least and 10 being the worst.
9 out of
9.
10.
Okay, that's pretty bad. So how long have you had that pain for?
It goes for like an hour and a half.
Ah, okay. So you've still got the pain at
Yes,
the moment.
and it's a sharp pain.
Sharp pain. Okay. So the doctor has charted some morphine for you. Have you had morphine before?
No.
So it's a very strong pain relief. So I can get that ready for you if you want, since you're having pain. So I just need to get that ready for you, and I just need to take your vital signs like your blood pressure, your respiratory rate, and your pulse and oxygen saturation, everything, just to make sure if it's correct. So is that okay if I take your vital signs now?
Sure.
Okay. I'm going to take her blood pressure, respiratory rate, pulse and oxygen saturation and make sure it's between the flags, and I'm going to record it on the back of this chart. Okay, Miriam, everything is fine. All your vital signs are good, so I can get that drug ready for you. So if you need me in the meantime, there's the buzzer here. The buzzer is here. So if you need me, just press the buzzer and I'll come. Otherwise, I won't be long. Okay? Thank you, Miriam. Can you be my second RN to validate the order? So I've got Miriam Adib here. I've checked her date of birth and MRN against the armband, and it's correct. She has confirmed she has no known allergies, and she has come up with the history of fractured ribs, and she's complaining of pain right now. So the doctor has prescribed morphine, 50 milligram in 50 mils, which is signed, printed, and dated by the doctor. And the morphine is to be administered through PCA, which is IV. So 50 milligram morphine in 50 mils normal saline. So the concentration is 1 milligram per mil. So the number of syringes is 3. PCA dose is 1 milligram. Lockout interval is 5 minutes. The basal infusion is 0 milligram per hour. So the hourly dose limit is 12 milligram, which doctor has signed. And so the doctor has ordered antiemetic, which is for nausea and vomiting, which is metoclopramide, can be given TDS. The dose and route is 10 milligram through IV, which is signed and dated by the doctor. The doctor has also prescribed naloxone, which is in case of overdose. The dose is 0.2 milligram through IV. Interval is 2 to 3 minutes, which is signed and dated by the doctor. and the drug hasn't been given today, and it's an IV narcotic analgesic chart. So I'm just going to confirm this order with MIMS. So morphine sulfate injection. So the use is for moderate to severe pain, and the adverse effects is respiratory depression, GI upset, dizziness, and PCA dose is 0.5 to 1.5 milligram in adults. So I'm happy that the order is correct. So and I've checked the injectable book as well, and it says that morphine is compatible with the normal saline. So I'm going to dilute my morphine with normal saline. Okay, so I'm going to gather my equipment now. Can you be my second RN to get the drug? To make the morphine 50 milligrams, I'm using the morphine sulfate 10 milligram in 2 ml ampoules. So to make the 50 milligram, I need 5 ampoules. So the balance here is 15. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And it's all morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, 10 milligram in 2 ml, 10 milligram in 2 ml, 10 milligrams in 2 ml. And the expiry date is October 2020. October 2020. So are you happy with the balance?
Yeah.
So I'm going to get 1, 2, 3, 4, 5 out, and I'm going to put 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to put 10 back. So it's all morphine sulfate, and it's 10 milligram in 2 ml one. I'm going to put that back. I'm going to put discarding, and the balance is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The prescriber is Leanne Hunt, and that's me who is administering. Okay, are you happy to sign that for me? Okay, I've filled my asset book. Thank you. And for the first drug check, so I've got Miriam Adib here. I've checked her date of birth and MRN against the armband, and it's all correct. She has confirmed she has no known allergies. So that for her fractured ribs, the doctor has ordered morphine 50 milligram in 50 mils, which is signed, printed, and dated by the doctor. And it's an IV order, and it hasn't been given today. So I've got here the order dose is morphine 50 milligram. So I've got morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. I've got these are 10 milligram in 2 ml ampoules, 10 milligram in 2 mils, 10 milligram in 2 mils, 10 milligram in 2 mils, 10 milligram in 2 mils. So to make the 50 milligram, I'm using 5 ampoules, 1, 2, 3, 4, 5. So since this is 2 milliliters, this makes 10 mils. um, and it's all expiring in October 2020. October 2020, October 2020. So the morphine makes 10 mils, and I'm using 4 of normal saline. 1, 2, 3, 4. Normal saline, normal saline, normal saline, normal saline. And it's 10 mils. 1, 2, 3, 4. 10 mils, 10 mils, 10 mils, 10 mils. And it can be given through IV, 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 IV. And it's all expiring in September 2018. September 2018. September 2018. So I'm going to use 1, 2, 3, 4 to make the 50 mils volume. So I'm going to prepare my drug now. So that's 40 mils. You happy with that?
Yep.
40 mils of normal saline. that's 50 mils. Are you happy with that? With 50 mils?
I want to see 50 mils.
50 mils. I'm going to put my sharps in the sharps bin. I'm going to prime my line now. So the line is prime without any bubbles. And I'm going to do my additive label now. So the patient's name is Miriam Adib, and her ID is 174963, and date of birth is 7/1/69. Medicine is morphine. Amount given is 50 milligram. Volume is 50 mils. So the concentration is 51 milligram per mil. Dilutant is 0.9% normal saline. And date is 12/5/17. Prepared by me. Time is 2:30. Can you just sign that for me? Thank you. So that's my label. So I'm going to stick my label to the syringe. So can you be my second RN for the second drug check, please? So I've got Miriam Adib here. I've checked her date of birth and MRN against her armband, and that's all correct. She has confirmed she has no known allergies, and the doctor has ordered morphine 50 milligram in 50 mils, which is signed and printed by the doctor and dated as well. And it is an IV order. I'm going to use a PCA machine for it, and it hasn't been given today, and the patient is in pain, so I'm going to give it to her now. So I've got here morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, 1, 2, 3, 4, 5, expiring in 2020, 2020, 2020, 2020, and it's all 10 milligrams, 10 milligrams, so that makes the 50 milligrams, and it's in 2 mils, so 1, 2, 3, 4, 5, that makes 10 mils, and I'm using 4 of normal saline 10 mil ones to make the 50 mil of the fluid order. So that's sodium chloride, sodium chloride, sodium chloride, sodium chloride, 0.9%, 10 mils, 10 mils, 10 mils, 10 mils, can be given through IV, and expiring in December 2018, December 2018, all of them. Okay, so I'm going to go to the patient and do my second patient check. So Miriam, I'm back with your drugs, I mean the morphine. So before I do anything, I just need to confirm your ID again. So can you tell me your name and date of birth, please?
Miriam Adid,
And date of birth?
7th of January 1969.
Can I just confirm with your armband? So I've got Miriam Adib, date of birth is 7 of 1st, 1969, MRN is 1749663. Any allergies, Miriam? No allergies? Okay, I'm just going to check your cannula site. Is there any pain around your cannula site? No pain? So I'm going to check the cannula site for any redness or swelling. The cannula site looks good and it's dated today. So I'm happy to put the PCA machine through this cannula site. So Miriam, I'm going to put the PCA, connect the PCA machine through your right cannula side, okay? So can you be my second RN for the third and final drug check? So I've got Miriam Adib here. I've checked her date of birth and MRN against her armband, and it's all correct. She has confirmed no known allergies, and she's come up with fractured ribs. That's why the doctor has ordered morphine 50 milligram and 50 mils, signed and printed and dated by the doctor. And it's an IV order, and it's due now, hasn't been given yet today. So I'm going to give it to her. So to make up the 50 milligram, I've used the 10 milligram in 2 ml ampoules. So I'm using 1, 2, 3, 4, 5 of them to make the 50 milligram. So morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, 1, 2, 3, 4, 5, all 10 milligram ones, 10 milligram in 2 mils, and it's all expiring in October 2020, October 2020, and it can be given through injection. And to make the 50 ml fluid, I'm diluting it with sodium chloride, sodium chloride, sodium chloride, sodium chloride, 10 ml, 10 ml, 10 ml, 10 ml. And December 2018, December 2018, December 2018, and 1, 2, 3, 4. Alright, so I'm going to get the PCA machine ready now. So would you like to see the setting that I do? So I need to make sure that you can see the drug name when I set up the PCA machine. So we're going to follow the order. Confirm new patient, yes. So modify the protocol. The drug name is morphine. Drug name is morphine. Confirm. The drug concentration is 1 milligram per mil according to the order. Confirm. The PCA dose is 1 milligram. Confirm. And the lockout period is 5 minutes. Lockout period is 5 minutes. Confirm. Oxygen level not given. Confirm. The loading dose is not given. The maximum limit is 12 milligram according to the order. Confirm. Limit duration 1 hour. Okay, so are you happy with the PCA setting? So I'm going to connect the PCA to the patient now. Hi Miriam, so this is your PCA machine which I'm going to connect to your cannula now. So can I just check your cannula site? I just need to clean your cannula, okay? So I'm going to clean it for 15 seconds. Okay Miriam, I've secured the IV line. So I'm going to start the PCA machine now. Okay. Okay Miriam, the PCA machine is started and there's a green button here. So I'll teach you how to use it. So see the machine, see the light is green now. So when it's steady green, you can press the button and get a dose of it, and it will make a beeping sound. So after that dose, there's a 5-minute lockout interval. So if you have a dose now, the next dose will be in 5 minutes. Okay, so you can use that now to control your pain. And you have this button here to call me if you need me. But the morphine drug can cause you some side effects like dizziness, nausea and vomiting, and GI upset. If you have any of those side effects, just press the green button, the call button, then I can come and give you some medications for it. Otherwise, I'll come and check you in 15 minutes, okay? Can you sign the medication? So I'm going to sign the medication chart. So the date is 12/5 and the time is 11. Sign that for me. So I've signed the medication chart.